All right, we are recording and we are now live.
We are now live. Wonderful, wonderful. Thank you everyone for joining us today. My name is Kyle Shavasta and I'm the Public Programs Manager at the Community Health Training Alliance, a program of Philadelphia Fight. Yesterday, you all joined us as we discussed general diabetes management tips and tricks with Kim Lawrence. Today, we are talking about how diabetes is a financial issue as well and how to navigate that. Today, we are so happy to be joined by Teresa Sullivan, who joins us from Project Teach, another program of Philadelphia Fight. And we are also with
My name is Dr. Tashina Ritter, guys. I am the director of the Community Health Training Alliance. And as Kyle just shared, we are excited to have Teresa Sullivan here today to share her knowledge and experience on diabetes being a financial issue, too. So without further ado, Kyle, take it away.
Awesome, awesome. So yeah, yesterday we talked just really generally about what to expect from diabetes management, and today we wanted to discuss diabetes as a financial issue. So when you hear that statement, Teresa, diabetes is a financial issue, what does that mean to you, and what would you say to our audience?
So first, let me say thank you for having me today. When you hear the frame of like diabetes is a financial issue, what comes to mind is about healthy eating. How do you do that on a budget? And how those people, different nationalities, basically, because a lot of are people are African American or people of color or Latinx are known to have diabetes, right? And we also know that in those communities, a lot of people are living on a budget, right? Or people are living below the poverty level, right? Or they are on a fixed income, right? And we need to like figure out how do we navigate those finances when it comes to taking care of the condition of diabetes, because a lot of times with diabetes, a big part of what you eat plays a part about controlling your diabetes, right? And keeping your levels down and your A1C down. And for a lot of us, it's about how do I manage my weight with a healthy diet? And we know for a fact that a lot of foods that are recommended to us, like fresh vegetables, fresh fruits, are very expensive, right? Produce are not cheap. And especially right now that we are in a place with COVID-19 things and we're in a recession, a lot of people don't realize that, but we are. Everything is going up, costs you more and you get less, right? So that's what it plays a big part about how you navigate your income that you spend for allocated to your food in your house and how you stretch that budget out, but also stretch it in the way that you are actually getting the things that are healthy for you as a diabetic, right inside your house. And able to like take those things that you buy and make real healthy meals that taste good.
Wonderful. Yeah, no, that raises a lot of points and concerns. This does have a big strain on your wallet. Now, that
Mhm.
said, what are some creative solutions to this problem of diabetes being a strain on one's budget?
I'm glad you asked that. Being a diabetic for many, many years, I had to figure out like how do I stretch my food budget to fit my need to eat healthy, right? And it's not easy. It gets complicated, but there are some resources out there. There's several programs such as Misfits Market. They have this wonderful program. You probably seen it on the commercials. Get the box of food sent to your house. Some of those are very expensive, but Misfit is not that expensive. And that you can get the box of food with fresh produce inside of it, some meats and some nuts, and like the healthy eating choices that you should eat as a diabetic inside that box. You get to choose and pick what goes inside your box. With Misfits Market, they give you a choice of two kinds of boxes. There is a box that's $22. Then there's a box for $35. it depends on how much you get in your box and how much it costs to how many household members you want to feed, right? For example, my household is 2, not including my cat. Right? And for me and my husband, it would be the $22 box, where I would get fresh tomatoes, dark greens, which are real healthy for all of us, regardless if we're diabetics or not. I get potatoes and carrots, and I'll get choose some kind of meat. I usually, my go-to is low-fat meats like chicken, right? Boneless, no skin, a lot of fish, right? This is my go-to as a diabetic, and I get all them kind of things in the box. With Misfit, they give you the option to go on there and get it a reoccurring every week or bi-weekly. That means that you put your credit card in there. I know that feels kind of like off for a lot of people. Like, I really don't want to put my credit card on there. But you have the option to say, okay, I'm doing this for this short period of time now, and I want to stop. You had the option to just stop and take your credit card off and stop getting the deliveries. That's the Misfit marketing. People ask me, well, why is it called Misfit? Because a lot of times the vegetables are fresh, nothing's wrong with them. They sometimes, as a gardener, because I'm a gardener, sometimes when you're growing vegetables, they might not come out to the shape that you want them to be, right? They might bend a little bit or might, have a little bump on the side, but then nothing's wrong with them. And they are consumable, edible, and you can still eat those. That's the only difference with the produce that's inside Misfit. You also have Thrive Market. Thrive Market is basically the same thing as Misfit, and it also has the same opportunities to like go on, put your card on there, get your box, but it doesn't give you too many options for us to price. Two different boxes. And then you got Imperfect. I know a lot of people and like have heard of Imperfect Food Market, right? Where you get this box into your house, the same thing. It depends on how many people in your household you put on when you fill it out on the line, and you get this box sent to you. With them, you get the choices of dairy, meat, produce, and because it's like the pyramid of foods of what you're supposed to eat, and your grains. So you get to choose, like as a diabetic, I would choose cheese, eggs. My grains, I would do like the wheat or the rye breads instead of the white breads, and the brown rice, and the dark greens. I'm a fan of green peppers. I put peppers in everything. I'm a fan of hot, spicy foods. So I accommodate all that kind of stuff when I get my box. But that's one way to like offset some of your finance once a month. Or if you're going to do it once a month, you can do it once a month, or you can do it bi-weekly. I recommend you do it according to your income. Is what I recommend. And for me, I will do it once a month because I also shop other places for certain other things that I need in my house that I can't get from these places that I'm talking about. So I can like have a variety of things in my kitchen to like cook up a real healthy, spicy meal, right? So those are things that's out there. There's one more thing that's out there. Unfortunately, right now, when I call them, it's called Food Share Program. They every year they have the holiday Thanksgiving turkey and the trimmings. It comes in a box. It's delivered to your house for $40, and you can use your SNAP benefits to pay for it. Unfortunately, right now, because the need is so strong right now in our community, they out for this year. They will start up again probably next year, unfortunately. And that just goes to show you where we're at. When like I said about the recession, things are high, you get less, and what we're going through right now, and seeing food deserts everywhere we go. I never thought I would see it in Philadelphia, but you are seeing it because of COVID-19. There's also, for those who are over 60, is the Senior Citizens Program. It's called the Senior Box Program. There's a waiting list right now, and you can get on that waiting list, and they will direct you about when they would choose you to come and get the food and send stuff to you. That you can reach them at 215-223-2787. 223-223-2220. Again, that's 215-223-2220. And it's called Seniors Box Program for people over 60. Call them, get on their waiting list if you're over 60, and you'll get a free box of food sent to you to your house. On what basis, it will depend on what your need is for that program. Because what we know is our most vulnerable populations that are making real hard choices about paying the bills and paying the mortgage or putting food on the table are those people over 60. Right, so we must make sure that we're keeping those programs available to them, especially in this crisis that we're in COVID-19. So I advise everybody to take that number down again. That's 215-223-2220. It's the Senior Box Program for people over 60. As a gardener, and me and my husband started gardening 2 years ago, and we're still on our learning curve and getting better at it. But that's another way to offset that fresh produce price you see in the supermarket. Grow your own vegetables. If anyone ever's been on my Facebook page, you will see me showcase and showing out all my vegetables that I grow. I grow green peppers, jalapeno peppers last year. I grew watermelon, cantaloupe, squash, a bunch of tomatoes, right? Because we chop them up and we freeze them and save them. And that's another thing that people can do is, if you're growing your own little garden, and you don't need a whole lot of space to have able to grow a nice little cute little garden. A trick I tell people, if you don't have a whole lot of space to like turn over some ground and grow some things, you can always get the old trick my grandma taught me is the milk cartons, and you line it with plastic. You go to Lowe's or Home Depot and you get your soil, make sure it's organic. I'm real big on organic. And you can grow it inside there. It doesn't necessarily have to be in the ground if you don't have the room or the space in the yard to grow vegetables. You can grow tomatoes that way. You can grow green peppers that way. You can take those vegetables, you can eat them, you can cut them up, freeze them for a later date, which a lot of times that's what I do. A lot of my butternut squash, you can have that up into a year just in a cool place, and it doesn't go bad. You don't really have to refrigerate it. And we love butternut squash because it's healthy for you and it's a healthy choice. So you can do all those kind of things. And there are programs out here in Pennsylvania and Philadelphia called Garden Share. If you don't have the room to start a garden, and it's a great thing to be part of your community and start having a garden share where you and a couple other people will have a certain, you can like get a certain amount of space to garden together. And you can take those things once you do your harvest and pick your vegetables, you can share them with each other. You can have them for yourself. Y'all can decide if y'all want to do an outside little fresh garden stand to get people to come get like fresh vegetables at a reasonable price. And it's just a way to pay it forward when you're doing it that way. And it's therapeutic. I mean, it gives you like the pride to watch something grow. Is the most beautiful thing I've ever seen in my life. Right, and be so proud of what you grew, regardless if it's not growing as quickly as you wanted to, and you just learn how to like do better every time you do it, and you research and find out that, oh, maybe this year I need to use this kind of soil, or maybe I shouldn't grow this because it takes up too much room, which I learned the hard way with the watermelon, because watermelon is a vine and it just grew all over my yard. But I got some beautiful watermelons. They were enormously big and very fresh and very sweet and organic because I grew them in organic soil.
So Teresa, you just dropped like so many juicy nuggets about not only a budget, but resources and creative ways to create accessible food. First of all, when that ebook coming out? When you dropping that ebook with all these resources that you're gonna write?
I listen, I need to sit down and take the time to do that. A lot of the stuff, like I said, I just mentioned, I did a lot of videos on my Facebook page where people can come onto my Facebook page and you can see the videos of me and my husband in our garden, and at the beginning, the middle, and the end. It's not really easy because it's work.
Mhm.
Gardening is work. And you think like, oh, grew this stuff is wonderful. I'm going to eat the stuff. When your harvest is over, you have to clean that yard, right? You have to pull all that stuff out and turn the dirt over again, right? Because that's part of being a gardener, is you doing like vegetables and fruits and stuff like that. Um, so I don't know when that book is coming out, but if you go to my Facebook page again,
So
you'll
you
see that too.
the way you was sharing that information, I said she must have an ebook somewhere that we can. I
Yeah.
mean, it was really helpful because just listening to it, and you, I mean, I'm sure you can relate to this, and you too, Kyle, that it's cheaper to eat cheap, right? You have all these different sales, and you got dollar menus, and it's easy just to go and grab something to eat. But when you're dealing with diabetes, you have to be something. You have to be careful with what you eat. So, I can imagine the financial strain it can cause people, have on people when they trying to budget the money they have for bills and other life essential items on top of having to have food to eat, right?
Mhm.
And so thank you for sharing those resources. There were a lot of them. So I have a question for you. And perhaps we can take those resources and post them on our Facebook page so we can share those resources for folks.
Great.
Is there any criteria, like any criteria around of people's income, or is this free to the public, that people can access these resources?
So it's free to the public. They are online services. Misfits, Thrive, and Imperfect Food. Anyone can access them and go on, fill out, become a member to get these boxes of food sent to their house, which makes sense in a lot of ways because of COVID-19 right now. We want to limit how much we're out and about in the world, right? So having like a box into your house that has fresh produce, and if you choose to get meats in there, and everything's packed really safely, right? And if it's meats, it's packed with that dry ice to keep it cold. And it comes in enough time for you to use it. So that's not an issue. And it keeps you from like venturing out as much as you normally would if we were not in COVID-19, right? And it's a way to also um, budget your finances around the produce piece, right? And even the meats and the fish and stuff is really getting expensive,
Mhm.
right? So we want to make sure people like have these kind of resources and tools in their toolbox. But you still probably have to like add some more. Like I said, I add other things to it, and it's beats me going to Whole Foods, right? When if a person's on a fixed income or receiving SNAP benefits, you don't want to go to Whole Foods and walk out with 2 bags. Right? You want, and especially if you got little people in your house and you got children at school age who are not at school because the schools are closed right now, and children tend to eat a lot more when they're home,
Yeah.
right? And you have to make sure that you're keeping that fresh, healthy choices for them as well. And I heard a lot of time, a lot of people, and like my sister who's also a diabetic, struggled for some time when her kids were in her house and she had to make 2 different meals, one for her and one for them. And I came up, I like, I'm not doing that. I'm going to cook in a way that we all can eat,
Mm.
right? And like being real, like really savvy around like meals that you can cook in one pot. There is like I said, I like spicy foods. There's the spicy rice. It's the smoky spicy rice meal. It has a lot of fresh vegetables in it. Brown rice. You can add meat if you want to, and you don't. And if you're a vegan and don't eat meat, you don't have to. Things like that. Do a lot of stir fries. It consists of like onions and green peppers and carrots, shred them, the carrots, and add your little flavors and your seasons to it. Your boneless, skinless chicken, you
Mm.
can do that as well. And one thing I'm recommending, which I invested in, was a air fryer, because I felt like putting the grease in my body was not helping, right? So, because we all know that we tend to like things that are fried, and like French fries and fried chicken. And I was like, how can I have all these things but without the grease?
Mm.
And it's the air fryers. They are not they're not cheap. Let me say that first. But it's worth the investment, especially if you're talking about being a diabetic and picking and choosing healthy choices. It fries, it grills, it bakes, it air crisps, right? And with no grease, right? I fry chicken in it. I bake chicken in it. I make French fries when I want to have French fries. Everything in moderation for me, right? So I tend to eat what I like to eat, but in moderation. And I tend to like make sure the foods that I put together will not raise my blood sugars,
Mhm.
right? Doing those healthy choices, like when you fry rice and brown rice, you don't even realize that it's brown rice. It just tastes so good, right? So doing those kind of things and making sure that you're combinating all these foods that are healthy and keeping it really green. If your foods are looking gray on your plate, you need to rethink what's on your plate and make it more bright and colorful. Those are healthy
Listen,
foods.
Teresa not only got an ebook about how to budget your money and buy healthy food, she dropping nuggets about how to cook, creative ways of cooking, and how you can
Yeah,
mix up, different foods, which is I think it's helpful because people often feel like to eat healthy is expensive, but also you have to have an idea to vision a meal, how to put it together to make it taste good, to make it appealing. I don't know about you, but sometimes I can eat the same thing over and over and over and over again and get bored.
right,
So I'm glad to hear that you're sharing about different creative ways to make your food interesting, fun, colorful. You're giving different methods of cooking, like the air fryer. And I think this is great information for our audience to have. And speaking of the audience, Cal, is there any questions out there for us, for Teresa?
Let me check. No, not at the moment, but always drop your comments even after the fact.
Mhm.
We're always happy to provide resources to folks. So
Yeah. And so, wow, this was really helpful. It was a lot of information, and we definitely want to get those resources from you so we can post to
right.
our page. And so, before we close out this episode of Cheetah Chat, is there some words of advice, any suggestions or recommendations you have for the audience around budgeting, around the foods that's been that's reasonable to purchase that can last or stretch that you can stretch for meals and different things that they can do with foods.
Yeah, thanks for asking that question. Especially around right now, we want to stretch as much as we can. And I would say make sure you are doing a budget. I know we hear it a lot. Oh, have a budget in your house, but actually having a budget does work. And also, one thing I found really helpful when I'm shopping, I make a food list, a shopping list before I go. Because if I don't, I'm buying everything in the store. So, and I get home like, oh God, I already had this. Take inventory of what you need inside your house, right? Go in your kitchen the night before you go shopping. Like, take your pencil and your paper and like, okay, I really don't need eggs, so I'm buying no eggs right now, right? So, and it just mark down what you need to buy, and look at other resources where you can get fresh produces like the resources I gave you and get that home delivery. As long as you want it, know that if you don't want it anymore, you always can turn it off, right? If you're not happy with it, you get your money refunded to you. That's why I love these programs. And like, just make sure that you are just doing the healthy choices. Don't beat yourself up. Eat what you like. Love what to eat what you like, but eat it in a healthy way where you're not over essentially eating it. We all tend to like something, we just go way overboard with it, right? There's no necessary reason for you to like deny yourself of food, especially right now. We all are mostly eating in some kind of form,
Mhm.
right? So just, take it easy, give yourself your favorite little snacks in moderation,
Mhm.
right? And make sure that you're monitoring your diabetes and staying connected to your provider, staying on top of your lab work that you need for your diabetes. Try to get a little exercise in. I know that's difficult with COVID-19, but take a walk around your block. Um, walk up and down your stairs if you need to, right? That's a form of exercise, just walking, right? I heard you yesterday on, and I was laughing when I was watching it because that's what I do. You can sit in a chair and exercise.
Mhm.
We do it once a week. We'll do it tomorrow on Teach Alumni. We have this video for about 15 minutes and we all exercise from a chair.
Mhm.
So that works too. It's just moving the body and keeping the body in motion, right?
Mhm.
It's very important for your blood circulation, right? In your heart, right? In your lungs. Do all those kind of things the best that you can.
Mhm.
And just, give yourself a break, as a diabetic, and just know that it's going to be okay if you put all these things in place,
Mhm.
right? And the most important thing is to make sure you're having conversations with your provider,
Mhm.
right? And your nutritionist as well. And take the ideas you have and run them by them,
And
right?
I have a question for you, Teresa, because I think as the holidays are coming up, and you mentioned something
Yeah.
about snacks. I know I'm a snacker. Lord knows,
Mm-hmm.
snack, you get bored, you're working, you eating, right? And so
Mm-hmm.
I think especially important for those individuals living with diabetes,
Mm-hmm.
especially with the holidays coming up, you got
Yeah.
cake, all types of sweets. And what are
Mm-hmm.
some things you recommend in terms of snacking? And there's some treats sometimes. People want an ice cream or they want different things to eat. What would you
Mm-hmm.
recommend they do or should purchase for snacks?
That's a great idea, and I'm glad you asked it because I was thinking about the holidays right around the corner too, and that sweet potato pies because I'm the aunt everyone comes to and
Mhm.
drop the stuff off to make the pies. My niece will be here today at 2 o'clock. I'll make hers with the sugar, and I'll make mine with the substitute sugar, the Splendor,
Oh,
right? And it tastes just as good. That is one thing you can do with the pies. Far as the healthy treats, if you're going to eat a potato chip, and I know a lot of people love chips, try to get baked chips. They less greasy, less calories, right? If you're going to eat chips, if you're one of the people like to snack, try changing up and having that healthy snack like nuts and fruits mixed together. Like you can have roasted almonds and cashews and with a mixture of little M&Ms with the chocolate because you want that little sweet piece to it. And that's like take a handful of those, and that would curb that snacking crave that you had, and you won't over obsess on the donuts
mhm.
because you want that sugar. I mean, it's a healthier choice to have the nuts involved in your life, right? Low fat popcorn is my go-to. Well, in my house when I'm like sitting around like, oh my, I want a snack. And I'm having that like rush about what do I need to eat, and I get the popcorn, the microwave popcorn, but it's low fat.
Mhm.
Everything again in moderation.
Mhm.
Um, Sometimes instead of reaching for the little Debbie, reach for the banana,
Mhm.
reach for the oranges. You can cut fruit up and put it in like a fruit cup, right? And it tastes, and you put a little Splendor on top of it, and it tastes just as good.
Mhm.
Right? When it comes to the snacks around the holidays, and other people are like, I want the pies, I want the cake, I want the ice cream. Now that we're coming up on Christmas soon, the nutmeg, will spice it up, whatever. Be real careful around nutmeg because it holds a whole lot of sugar. I wouldn't advise a person who's a diabetic to drink nutmeg. It's just too sweet. And for
Like eggnog,
alternatives,
wouldn't you drink
yeah,
eggnog?
like the eggnog, I would tell people, which I had to do because I love the Pepsis, right? And the Pepsi seems to be the go-to for diabetics. I don't know why. Um, but I switched up and I do Crystal Light.
Hmm.
Crystal Light is just as got a nice little sweet taste to it. It comes in a variety of flavors. I make a picture of it. It lasts me all week in my refrigerator, and I ain't got to worry about reaching for that Pepsi or that diet the diet sodas. I really don't like it. I don't like the taste to them, but I like Crystal Light.
Mhm.
So that's another option when we talk about things that you might want to drink during the holidays.
This is great to know, and I want to let the audience know that while we're not medical doctors, professionals, we're
Mhm.
speaking from Teresa sharing her lived experience as an individual living with diabetes. And I think it's helpful to hear also the other perspective that we may not always hear about, this living with diabetes. And so I think this is great information just to have also even if you're not diabetic, just to
Right.
maintain your health. They say your health is your wealth.
Mhm.
So, especially when living with diabetes, it's even more important to monitor what you're taking in. And so I thank you for sharing all of that
You're
information.
welcome.
I probably call you up like, Teresa, would you say that? You got
Feel free to call me, send me an email, send me a text. I'm more than happy to share this information with anyone who wants it. I know for me that it worked out for me this time around because my sugar and my diabetes landed me in the hospital in December. And it was about a behavior change, right? And I was gung ho to make that behavior change when it came to the way I eat. And I felt like if I could stop smoking cigarettes, I can change how I eat. So I made that behavior change, and I'm better off for it now.
And behavior change is so important, but it's also very hard
It is hard.
to break habits and having something that you can replace it with, right? So it's like
Yeah.
unlearning old behaviors to learn something new.
You got to unlearn. You got to unlearn those old behaviors and replace them with more positive, new behaviors before you like unlearn certain things. But I also tell them like you got to meet yourself where you're at, right? And don't like beat yourself up because you might not have reached your goal. That's okay. Just keep moving forward, right? Keep it moving, right? Don't give up. There's a lot of times, and I'm just going to talk about my cigarette smoking. It took me a long time, to stop actually smoking. And me and Kyle were talking about this a lot of times on the job, but I actually coming up on 2 years. I'm coming up on 2 years, and the year before that I fell. I got 7 months. I'm like, oh, screw it, right? But this time I did it with in mind about my pros and cons. What am I going to benefit from it, right? And why I should need to stop it. You can look at that with anything in your life when it comes to behaviors. What am I going to gain, and what bad habits I'm going to put away, right? To be my full self of who I should be.
Awesome, awesome. I love this. This is some great information. Kyle, what are your thoughts? Any last thoughts?
I think this was tremendous. I think that between you and Kim, you've provided us with a wealth of resources and tips and tricks. And today's not the last day to hear from you, Kim. We're really excited to have you again tomorrow as well to kind of wrap up this week of diabetes management as we enter the holiday season. I'm particularly struck by your notes about food and how food impacts diabetes and how money is deeply tied to food acquisition and how we need to think about all of those things, the trifecta of money, food, and diabetes all together, and it's unfortunate that healthy food is not accessible food sometimes, and I think there's a lot of advocacy that can be done around that, and we will definitely provide resources to that as well. So thank you for making a note about that.
Yeah.
So this was great. Thank you so much for taking time to spend with us to share your experiences and knowledge about, having diabetes, but also being on a budget and how you're managing the budget and how you're being creative with your food and different resources. So we thank you for everything that you shared, and we definitely will be posting these resources on our page. And so
absolutely,
we have come to the end of our CHTA chat. Again, thank you, Teresa. Thank you.
You're welcome.
Watching. Kyle, any last thoughts in close out?
Nope. Join us tomorrow.
Okay, see y'all. I'll definitely see y'all tomorrow. Bye.
All right, see you, everyone. Bye.